Hello, so my name is Angelica, and today my group will be presenting cirrhosis. So first is etiology, which is the cause of cirrhosis. The first main one is chronic alcoholism. Second is genetics. The third is viral hepatitis C, which is the main hepatitis involved. And the fourth cause would be NASH.
In cirrhosis, the architecture within the liver is changed or altered, and as it develops, scar tissue replaces healthy liver cells, and the smooth texture of the liver becomes very nodular. And as a result of this, a lots of free flow blood throughout is compromised. And when these cells become injured or damaged, they usually die off. And this dead tissue from that was previously full of cells becomes fibrotic.
This is usually irreversible. And fibrosis is a process mediated by special cells called stellate cells. And hepatocytes secrete paracrine factors that activate and change stellate cells when injured.
You're still mute.
When activated, the stellate cells lose vitamin A, proliferate, and start secreting transforming growth factors beta-1 or TGF-beta.
Stellate cells can also cause the production of collagen, fibrosis, and also scar tissue.
Fibrotic tissue can build up and compress central veins and sinusoids. This is elevated pressure, which then in turns to portal hypertension within the portal veins. The epidemiology is common among males with cirrhosis. In 2015, 2.8 million people were affected. Of those people, 1.3 million people had died. Alcohol was the main cause. As I mentioned, alcohol caused 348,000 cases. Hepatitis C caused 326,000. Hepatitis B caused 327,000 in cirrhosis.
Some signs and symptoms of cirrhosis. The most common signs would be the patient would experience like easy bruising and bleeding. The lower extremities of the body are also going to become very swollen. There is also going to be some noticed weight loss. The patient will experience jaundice, which is a yellowing of the eyes and of the skin. And there will also be spider-like vessels that are going to be more prominent. Some symptoms will also be more fatigue throughout the day, not very hungry. It's going to be a big loss of appetite. It's going to be very nauseous all the time and itchy skin as well. For the chief complaint of cirrhosis, the most common complaints would be of the new bruises that are going to be forming on the body, the jaundice, which would be the yellowing of the skin, the feeling of weakness due to the fatigue, and lots of pain in the lower abdominal area as well.
Upon physical examination, ascites is suggested by the presence of abdominal distension, bulging flanks, shifting dullness, and elicitation of a puddle sign. And that picture describes how they do that examination for the puddle sign. Other things that come upon the physical examination is asterixis, inability to sustain posture, fetor hepaticus, which is a chronic distinct breath. Usually it's very sulfuric. And then differential diagnosis, things to consider. Conditions to consider in the differential diagnosis is ascites, varices Budd-Chiari syndrome, intracranial lesions, infections, metabolic encephalopathy, hyperammonemia from other causes, and toxic encephalopathy due to alcohol.
For the workup, a physician will have the patient complete a couple of tests to diagnose cirrhosis. Some will be lab testing that include complete blood count, liver function tests for enzymes, transferrin, saturation, viral hepatitis serologies. Imaging testing might also be ordered, such as an ultrasound, CT, or MRI. Sometimes even a liver biopsy is if necessary to determine how severity of cirrhosis is. Treatment for it will include, will all depend on the cause and how severe damage is to the liver. Since they cannot be reversed, further damage can be prevented. Stopping the consumption of alcohol, especially if cirrhosis is due to alcohol abuse, changing lifestyle, such as controlling blood sugar levels, a healthy plant-based diet, losing weight, and exercises. Some medications are also used to treat it. In severe cases, a liver transplant might be needed.
Since cirrhosis can't be cured, the patient can still be treated and continue to avoid certain risk factors that may cause the disease to flare up. Most patients will continue to be asymptomatic for many years following. However, 5 to 7% of persons with cirrhosis will observe symptoms such as jaundice, ascites, and hepatic encephalopathy. Treatment is also available in the case that it does. Patients can avoid risk factors such as drinking alcohol, smoking, and improving their diet, as mentioned in the last slide. And it can also accompany life changes, and this will most likely the patient will not encounter the disease again if these changes are made.